Well, aloha. It's great to see all of you here on this May 27th here on the platform of the Honolulu Star Advertiser Facebook page. This, of course, is the COVID-19 Care Conversation, a discussion and really a show that is brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health, really to engage our community, to connect you with leaders and with those professionals in the medical industry as well, as we sort of navigate through this COVID-19 pandemic. I'm Ryan Kalesuji.
And good morning, I'm Yanji Denise. Thank you so much for being here this morning. We have a very special guest, Dr. Huidy Shu, who is a neurologist and the medical director for neurological services at Pali Momi Medical Center, is joining us. It's very interesting because we've been so focused on COVID and, of course, the symptoms of that, but other medical procedures and other medical issues have often fallen by the wayside, and we've been seeing a huge decline in emergency room visits for things like strokes and heart attacks. Does that mean that fewer people are actually experiencing these ailments? Probably not. So what's behind that? We're also going to be talking to Dr. Shu about some issues related to COVID and the heart and some symptoms that they've been seeing in people who are otherwise healthy and young. So we're looking forward to an update from him on all of that, and also how to stay heart healthy because it is National Stroke Awareness Month.
That's right. So we encourage all of you who are watching to enter your comments into the comment section, to share this post as we begin this discussion, a very important discussion about health and keeping healthy during this time beyond just everything that's going on with COVID. There's also a lot of things. So we're going to be excited to talk to him about some of those issues and encourage all of you to enter those comments. Of course, we'd like to start our show by sort of providing an update with the recent count of COVID cases here in the state of Hawaii. And again, for yet another day, we had no new cases reported. The total continues to stand at 643. Now, there have been no new deaths. That remains at 17. No new deaths for the past 2 weeks. This is, again, the third day in a row of no new cases, the seventh time this month. And Oahu has had no new cases in 6 days. Hawaii has had no new cases in 6 weeks. So more than 92% of those infected have recovered. The numbers continue to show that curve is flattened and that really COVID-19 is not as prevalent as once we saw even a month ago here in the islands. And that has led to some decisions by lawmakers and by city officials to begin reopening parts of Oahu and the state, including Honolulu Mayor Kirk Caldwell, who made an announcement yesterday about some of those places and establishments that will be reopening.
That's right. A lot of person-to-person services, things like getting a haircut, getting your nails done, barbershops, tattoo parlors, they can all resume business this Friday, provided that the governor signs off on that. Of course, the way that the regulations work is that the mayors make the request, and within 24 hours, the governor will say yes or no on that. So very interesting to see. Outdoor venues are going to start opening up more, of course, with proper social distancing, and outdoor gatherings. This one is very key for a lot of folks, of 10 or less people, but they can be from different households. So that is a huge change. A lot of people have been heading out to the beach, but they've been encouraged just to stay within their own family unit. Now you can meet up with a friend or meet up with another family member who perhaps you haven't seen in a while. Of course, maintaining as many safety protocols as you can, wearing a mask when appropriate, washing your hands, and being, of course, cognizant if you or anyone you know is sick to, of course, stay home. But we are sort of seeing the relaxing of some of these regulations. And after 3 days of those no new cases, it does feel good to see that we are starting to creep back toward life the way it once was.
Yeah, and so again, the mayor will be waiting to get the approval from the governor. Also included in that was sort of a timeline of other things that the mayor would like to see open in the coming weeks. And again, once this week goes by, he sort of laid out the plan for gyms to be reopened, movie theaters to also begin reopening here on the island of Oahu. So we will see sort of how this sort of unfolds as the city sort of begins to get people back to work and things begin to resume somewhat of a normal life with, of course, those social distancing measures.
Of course, it's so important that we stay connected with our medical providers, and that's why we're so excited this morning to welcome Dr. Huidy Shu from Pali Momi. As we said earlier, he is a neurologist and the medical director for the neurological services at Pali Momi Medical Center. Thank you so much for being here, Dr. Shu. Let's get to what we talked about right off the top, and that is that decline in people getting services or seeking services for things like heart attacks and strokes. What are you seeing?
Yeah, here at Pali Momi, we've seen a 30% decrease in patients coming in the first few hours or first day after the onset of a stroke symptoms. It's not so much different than what people have been seeing around the world, honestly. There's recent papers published from China saying that people in China during the COVID epidemic there have had a 30% decrease in acute stroke treatments there, because they believe that patients have not been coming in at the beginning of their stroke as they normally do.
Now, that doesn't necessarily mean that people aren't having these ailments. It just means that they're not actually getting the care. What's the danger of that?
Yeah, strokes obviously can leave people disabled for a lifetime. And so, as many people know these days, stroke treatments are increasingly effective, but they need to be given at the very, very onset of the symptoms. So there's a medicine called TPA that can be given within 4.5 hours of the onset of symptoms. There are surgical procedures called thrombectomy that can be done within either a 6-hour window or sometimes, in select cases, all the way out to 24 hours after the onset of the symptoms. But beyond 24 hours, none of these treatments are safe to provide. And because of that, we highly encourage patients at the very beginning of the symptoms to call 911 and to come as quickly as possible.
How has COVID-19 sort of impacted some of the maybe it might be a existing health condition or something that may have led into some of these other ailments, such as strokes and such as heart attacks that may have been caused by COVID-19? Has there been sort of that relation where COVID-19 has sort of elevated the risk level for certain people who have suffered from COVID-19?
Yeah, no, I think COVID-19 has affected our stroke population and our heart disease population in several ways. So number one, we found that people with the most severe COVID cases, the ones who are in the ICU, the ones that need mechanical ventilation, those patients have a much higher risk of developing blood clots throughout the body. If they manifest in the brain, then they'll have a stroke. If they manifest in the heart, they can have a heart attack. If they manifest in the lungs, they get something called a pulmonary embolism, which is very severe as well. And so we know that these very severe COVID cases do cause these symptoms throughout the body. We also see an indirect effect, as Yunji has been alluding to. We see patients who seem to be concerned about getting sick at the hospital because of COVID, not coming in when they should, not coming in at the very onset of their symptoms. We've seen patients, again, at Pali Momi, where they've come in several days after the onset of their stroke because of these types of concerns. It's natural. It's very understandable. Of course, I think everybody in our state has been very, very concerned about the spread of COVID, but because of the severity of the strokes and the heart attacks that are happening, these patients really do need to come in as quickly as possible.
Tell us a little bit about how you've changed your own practice since this has all come to pass. When we talk about telehealth, is there a way for people who are very concerned about physically coming in? Is there a workaround? I mean, obviously, if you're having a heart attack, call 911, as you said. But for some patients who might need a follow-up visit or just, to maintain that relationship with their doctor, how have you integrated telehealth into your practice?
Yeah, telehealth has revolutionized healthcare as we know it here. I think throughout America, we are never going to go back to the days where I think where all of healthcare is in the clinic. In my office practice, at this point, I would say 90% of the patients that I see are through telemedicine. Video visits for the most part. So I get my laptop out and I put on a little headset like this, and I can beam in and out with into a virtual room with my patients, And the feedback that we've been getting here at Hawaii Pacific Health is that the patients love it. They don't need to spend an hour waiting for the handy van to come in, right? They don't need to find parking at Pearl Ridge Shopping Center to come in. They don't need to wait in the waiting room and be exposed to other people who they don't know, who they might be concerned about having COVID. They don't need to be exposed to all these people, and they can quickly talk to their doctor in just a matter of minutes on their cell phone from their own living room. And so the feedback has been tremendous. Our patients love this, and we really see this at Hawaii Pacific Health. We really see this as the future of medicine in many ways.
To speak to that degree, I mean, telehealth is one option, but there's still people that, of course, have to come in to see you physically, be it if there is an emergency. And if there is some hesitation there, I mean, what are sort of the protocols and procedures now that Pali Momi has put in place? So let's say that there is somebody that is COVID positive that needs to come into Pali Momi. Is there a protocol that has been set up to treat those patients, to maybe contain them to a certain area where those who may have to come in may not have to worry about the interaction between their treatment in their side of the hospital and someone else who may be COVID positive?
Absolutely. There are very, very, very strict protocols that are in place at all of our Hawaii Pacific Health hospitals, where the COVID patients are treated very carefully, I think very compassionately, but in many, many ways separated out from the rest of the population. All of the patients that come in the emergency room are immediately given a mask so that they can limit their exposure, exposing themselves to other people. All of our providers at all of our patient encounters wear a mask as well as a face shield, so that, God forbid, if any of our providers get sick, that they aren't going to be spreading it to anybody as well. In the offices, we keep social distancing practices very, 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 very strictly. We space out 6 feet. In any waiting area, we've taken the chairs out of many of our waiting rooms to try to maintain the 6 feet spacing. The schedules for our doctors are spaced out now to longer intervals in between patients, to try to make sure that the patients don't necessarily have to interact with each other on the way in or on the way out of the office. The COVID patients, again, we take pride in treating our COVID patients with the best medical care possible, but also with the most compassionate way possible. We have special isolation rooms in all of our hospitals, where the air exchanges are done in a certain way so that the virus can't get out of the room and can't get out to the rest of the hospital. And so all of these measures have been put in place because of our concern about the community and about keeping all of our patients safe.
We talked a little bit about at the top before you joined us, just about some of the measures the mayor is now taking, allowing more people to come together, outside of their own households. We're seeing restaurants opening up probably the 5th of June. Retail is starting to open up. As a doctor, when you see the relaxing of these rules, what are some of your concerns? I know that this can be a policy question, but just on a medical perspective, what's your sort of read on how prevalent the virus is here in the islands, and is this a good time to be doing those things?
Yeah, no, I think it's difficult for me to comment on, I think, the policy decisions of our county and state leadership. I would say this, though, that as a physician, we are monitoring all of these decisions very, very carefully, and we are trying to be aware of what might happen when these restrictions are relaxed. Right? Of course, we understand, we want life to get back to normal, of course, just like anybody else in our state. We want eventually tourism to come back as well, just like anybody else in our state. We see the need for all of this to happen, of course. But we are going to be vigilant in the healthcare community to be prepared for a next wave. We don't know that there's definitely a next wave coming. We suspect that there might be, but we don't know for sure. But we have to be vigilant for a next wave, so that if this happens again, we're going to be much better prepared, and we're going to be ready to go at the outset.
We're seeing reports from across the country of young, somewhat healthy adults who are experiencing strokes and other symptoms that are somewhat related to the SARS and COVID-2 and some of those things with blood clots. And what can you tell us about some of those reports and some of the things that are happening in the mainland that may be or may not be related to this COVID-19?
Yeah, no, so that's a good question. There was a lot of press, I would say about 3 weeks ago, in the national press about exactly what you're talking about. And this stems from a paper published by the Mount Sinai group in New York City, I believe on May 5th. And what they showed was that in their group, they had, in their hospitals, they saw 5 patients in a 2-week period who were under the age of 50 with some of the most serious types of strokes called large vessel occlusions. And normally in the 2-week period, they would see on average maybe one patient in this age group, maybe over a month's period. So they saw this as a very, very significant increase, and I'm sure that's the case. I think this relates to the fact that COVID, again, when people have very severe COVID, it seems to predispose people to blood clots. And again, the blood clots can manifest in different parts of their body. Could be the brain, could be the heart, could be in their legs, could be in their lungs, could be in any of these places. And because of the sheer numbers of patients, I think, in New York City with COVID, they would see these increases that we maybe aren't seeing here. I've spoken with some of my colleagues at Queens Hospital, where they do the same large vessel occlusion treatments here in Hawaii, and they have not seen that same increase in those types of strokes.
We noted at the top that it is, of course, National Stroke Awareness Month. I think a lot of people are feeling a little stressed, and we've been inside, and so we might, miss some of the signs that we are having a stroke, or we might dismiss it as something else. So can you just lay out, what we should be on the lookout for, and if we are experiencing symptoms, what should we look out for, and what should we do?
Yes. So these days, the acronym we use to teach people about stroke is B FAST. Okay. So B stands for balance. So when people have sudden onset dizziness or sudden onset balance problems that's unexplained, that's a relevant stroke symptom. E stands for eyes. So sudden loss of vision in one eye, sudden loss of vision in both eyes, that's unexplained, of course. Is another common symptom of stroke. The FAST part is probably well known to many people. F stands for face, so facial droop on one side of the face, that's sudden and unexplained. A stands for arm weakness, so one side of the body, arm weakness. S stands for speech, speech impairment, or impairment of language. Is a common symptom of stroke. And then if you have any of those symptoms suddenly in an unexplained fashion, we recommend people call 911 as fast as possible. So that's T. T is for time. So B FAST is the acronym that we like people to know.
Yeah, great. I mean, that's an easy, simple way. It's funny how those little acronyms can actually help and keep people educated and aware. Our time is coming to an end here with you, but we just wanted to give you one last chance to, what would you maybe say to those, again, who are suspect or a little weary about heading into a medical facility, we know that we touched on telehealth a little bit more, but any reassurance or anything that you sort of want to provide to those watching out there that may have any hesitation about potentially coming in to see a doctor?
Yeah, at Hawaii Pacific Health, we are doing everything possible to keep our patients as safe as possible. And that means either interacting by telemedicine when we think that's the best way to keep our patients safe, but also in the office as well and in our hospital as well. We are doing everything possible to keep patients spaced out and away from any potential virus.
Okay, doctor, thank you so much for joining us this morning, and we will remember to be fast. I like that.
Thank you very much.
Take care. Thank you. Aloha.
You know, really interesting, Ryan, to hear him talk about not only, you know, the on the ground, what they've done to change, but also how telemedicine is really part of what will be a lasting legacy for medical providers and for patients after coronavirus is long gone, or, you know, at least under control, that we will be doing telemedicine for some time to come. And it does make sense. If you can log onto your phone and have a quick chat with your doctor and avoid all the hassles that he's talking about, not to mention potential exposure to other diseases, why not?
Mm-hmm. Yeah, I think it's one of those things that has sort of was around before COVID-19, and now certainly it has become a much an important tool, I think, in the medical community, that all these doctors, no matter if you are a primary care physician, all the way to, you know, these specialists who are now finding ways to see patients in different ways, and any way that it can help to alleviate any of the stress that people may have about coming in, but also make it more convenient. I think it's a win-win, and it's just it has been some time as they navigated through some of the procedures and how to keep patient confidentiality intact. But again, all those things have been resolved, and telehealth really has become sort of the future of what we can expect to see with some of these doctors and these office visits.
Yeah, and an important reminder that they've seen strokes and heart attacks coming in down 30%, but obviously those ailments have not gone away. It's just that people are not getting medical care they need. And those first, he was saying, 6 to 24 hours are so critical to avoiding lifetime complications. So if you or someone you know is experiencing anything, you know, what he described, please, please, please call 911. We want to move on to some other headlines before we leave you this morning. The governor is looking to potentially lift the inter-island quarantine soon. We are going to have Dr. Josh Green. He, of course, is the lieutenant governor, on tomorrow. He's been talking a lot about travel, and we will be asking him about this for sure.
Yeah, a lot of people are looking forward to, especially the inter-island lift. Again, the governor saying that they are close to making that announcement, but has not yet set an official date. We know that the lieutenant governor has publicly said he wanted it done by June 1st, which is just around the corner. So we'll see if that timeline is sticking to be, and what the lieutenant governor has to say also about those incoming visitors to the islands outside of the state of Hawaii, and how the state continues to manage through that. The governor also announced in his press conference yesterday that they're also close to sort of announcing how they're going to reopen tourism. But there seems to be a lot of question marks, again, of how they keep the island safe and really test these visitors that are coming in. So we'll also be speaking to the governor next week, Monday. But of course, Lieutenant Governor Josh Green tomorrow to get more information on that. And another thing that's also happening, I know that you're excited about, Hawaii Public Libraries offering takeout service, something that you actually asked the governor about a few weeks ago.
Right. Hey, books to go. And you know what? I did it, and it was super easy, and my books are ready. So we are going to be picking those up very soon. This is really awesome. If you are a parent and you are getting tired of reading the same stories again and again to your children, or if you yourself have been locked in the house and you'd like to get some new reading materials, there you go. Those are the stacks. You can't actually go and browse them, but you can browse them through the library's app. And if you search the App Store, it's just Hawaii Public Libraries. Your username is your library ID. Your password is the last 4 digits of the phone number associated with that library card. So if you've never used it before, just go right online. You can sign up. It's very easy. You order your books, and then when your books are ready, they send you an email, and you choose a 10-minute slot to drive up and pick up your books. And it's pretty easy, contactless, it's free, and hey, you can access the amazing resources. We so appreciate the Hawaii Public Library system putting this together for everyone. I think this is a great thing. And a lot of moms and dads who are tired of reading the same bedtime stories and don't want to necessarily order a bunch of books from Amazon, this is a great resource. And so I'm just so glad to see that. Bernadette is saying, can we have a guest from the airline industry? Well, we are focused on tourism, of course. And we have put out some requests for the airline industry. Also, Mufi Hanneman from the Hawaii Tourism and Lodging Association is going to be joining us next week. And we're going to get an update about what hotels are doing and just what the travel industry overall in Hawaii, how they are trying to, get back on their feet and survive this crisis. So definitely tourism is top of mind. And thank you for that suggestion, Bernadette.
That's right. And of course, we like to end always by highlighting some of the good things that are happening in Hawaii. And today we like to recognize Child and Family Services for their work in the community. And, they've really been doing so much to help strengthen families and fostering the healthy development of children, not only during this time, but really throughout their existence as a nonprofit organization. They're going to be offering 50 programs to Keiki Hapuna across the state, or they have been offering those types of programs. And so we want to mahalo and spotlight them during this time for some of the new things that they're going to be doing.
That's right. Earlier this month, the organization teamed up with First Hawaiian Bank to provide resources, services, and food to families who have been impacted by the coronavirus at the Festival of Hope for Families. That's a one-day drive-through festival with support from the Hawaii Community Foundation's Resilience Fund. The nonprofit hopes to offer more statewide services like this to screen families also for abuse and provide needed resources and information. Child and Family Services does so much for our community, and so we recognize them and the Hawaii Community Foundation along with First Hawaiian Bank as our Hawaii Heroes of the Day.
Yeah, thanks to them, and thanks for all the wonderful things that they're doing in the community. Again, we want to encourage people that if you have someone that you'd like to highlight for someone that's doing good in our community during this time, so please let us know and to enter those comments so that we can spotlight them during our Hawaii Hero segment. Also happening today, there is a food drive that is that is taking place right now at Aloha Stadium. Again, we're seeing this every Wednesday and Friday. So this food distribution happening today, and the last one actually happening on Friday. So they're sort of going to revisit this. They've been doing this the entire month. Long lines continue to be greeted by those who are distributing food items by the food bank and by their partners who have generously stepped up to help fill the need in this area. But again, that's happening right now. If you want to head down, if you're in the area, those lines sometimes are very long with people lining up earlier. So hopefully you can get in there if you haven't already, or if you're not already in line. But again, the next distribution will be on Friday.
Yeah, that's an amazing thing that the Hawaii Food Bank and their partners have put together, and we so appreciate them for all the work they're doing, not only on those Wednesdays and Fridays, but every day for our community. Tomorrow, of course, Lieutenant Governor Josh Green will be on here, and then Friday, Speaker Scott Saiki will be joining us to talk about some moves the legislature has been making when it comes to money with the CARES Act and also trying to balance the state budgets. What are we looking at when we look long-term? That money has to come from somewhere. And so where's it going to come from? Will it be cuts? Will it be taxes? Will it be a combination of all of the above, more from the federal government? We're going to ask all of that to the speaker. So we've got a lot to talk about. We thank you so much for being here with us on this Wednesday. Stay safe, socially distance, wear those masks, wash those hands. You know the drill.
We'll see you tomorrow here at 10:30. Aloha.